Hello, I'm Dr. Kathleen Wills from the Optimal Wellness Clinic in Epsom, Auckland, New Zealand. I'm an integrative medical doctor, and that means that I work with the best of both worlds of conventional and natural medicine. So today I'd like to share with you some information on asthma. So asthma is typically characterized by an allergic reaction to pollutants or some kind of food allergies, exertion, physical exercise, and this causes an inflammation of the bronchial air tubes and excessive phlegm, so it makes it really difficult to breathe. Oftentimes people end up using asthma inhalers, which give you a bit of a steroid or adrenaline puff to open the airways, and it can also be very helpful to just get that initial burst of antihistamine that you need to get you through the attack. However, sometimes if you can prevent this conditioning from happening, why not do that rather than just treating the symptoms? You know, in New Zealand, about 1 in 4 people suffer from asthma every year. And it's not only just adults, but it's also children. This is a growing epidemic in New Zealand. So what can we do about it? Well, at Optimal Wellness Clinic, we don't just treat the symptoms, we try to look at the core or the cause of this condition. So oftentimes what it can be is a histamine reaction, so an allergy reaction. So we might look at your food allergies, do a food allergy test. We might track your diet, so we would look at your diet, maybe look at a diary of what you've been eating even the past month. So a really detailed analysis of your diet to see if any of those items that you're eating are triggering this allergic reaction. We also might look at environmental factors, where you live. Are you exposed to mold? What kind of weather conditions you're around? Because even atmospheric pressure can set it off. So once we control for those conditions around you and what you're intaking into your body, we work with nutritional supplementation to help you open the airways naturally. So some types of nutritional supplements we might work with are omega-3 fatty acids, which are fish oils in their purest form, vitamin B6 and vitamin B12 supplements, selenium, carotenes, natural anti-inflammatories, so such things as bromelain, quercetin. Herbal supplements are extremely well tolerated, and they don't have some of the negative side effects that other anti-inflammatory prescription meds can have. Flavonoids like grapeseed extract is really good, as well as antioxidants. Vitamin C is powerful for boosting your immune system and decreasing your incidence of asthma reactions. Magnesium is wonderful. It's good orally as well as through a nebulizer. So if you're having an acute asthma attack, you can actually come into our clinic and we'll sit you down in a very comfortable room and give you a nebulizer, which is basically a breathing instrument where we can administer the medication straight into your airways. And instead of using a steroid, we actually use magnesium, which is a natural relaxant for your bronchial tubes. So it's a very interesting, innovative new treatment that we use. What else? DHEA is another hormone that can be responsible for the asthmatic reaction. So we would look at your DHEA levels, check all of your hormones by lab tests, just to see where you're at. If there are any necessary tweaks to your hormones in the form of bioidentical therapies. Also, licorice is very good. Powdered or root extract, excellent for asthma.
Why is it good?
Licorice stimulates the immune system.
Cool.
Yeah. So it's extremely powerful.
So licorice tea that we drink?
Yes, the licorice tea is fantastic, or you can even get it as an extract, like directly from the root. They make like a syrupy extract that's very, very powerful. It's also very good for blood pressure. It's very interesting, a very good root. So, however, I wouldn't say this is purely a case for natural or nutritional medicine. I would say this is the case for integrative medicine. So this is where my background comes into play as an integrative medical doctor. Because I would say to you, it's good to have that inhaler in your pocket for any acute conditions where you're out on a soccer field, a football field, rugby field, whatever. It's good to have that as an acute emergency instrument. However, also if you want to work on preventing that condition, come on in and I'll talk to you about supplementation to get you to the point where you can actually prevent or lower the incidence of asthma attacks.
Great.
Why are there so many people in New Zealand? Why is it so common in New Zealand?
Well, we have one of the highest pollen counts in the whole world. So there are a lot of people that are very prone to environmental allergens. The other problem we have is we use a lot of pesticides in our agricultural use. So pesticides, some people react more strongly than others. And thirdly, also the extreme weather changes. So as you know, this is an island and you have extremes of cold and warmth coming together and creating these interesting atmospheric pressure situations that can also trigger the asthma. And also just genetically, there are a lot of people that have inherited an asthmatic condition from their parents. Yeah. So it's a very interesting condition, but it's not an impossible condition to treat and to prevent. Okay?
Daddy?
So, yeah, it was great talking with you today, and you're more than welcome to come and see me at the Optimal Wellness Clinic in Epsom. I'm also available by Skype, so pass me an email if you'd like to meet with me, and I look forward to talking with you more about possibly treating your asthma. Thank you. I'm Dr. Kathleen Wills.
Good.
Thanks.